NHS England is no more. This organisation, responsible for running our national health service in England, is being absorbed into the Department of Health and Social Care. This significant change is happening gradually over 2 years. The government says this move will make things simpler and save money. The change means that NHS England will no longer be independent. Decisions about healthcare in England will now be made directly by the government. This has sparked debate. Some argue that it makes sense to streamline healthcare management. Others worry about the potential impact on patient care. The future of healthcare in England is uncertain. What is clear is that this change will have a profound impact on patients, doctors, and the NHS as a whole. It remains to be seen whether the promised benefits will outweigh the potential drawbacks. The coming months and years will be crucial in determining the success or failure of this major shake-up of our healthcare system. The government has high hopes for this merger. They believe it will save a substantial amount of money, around £100 million. This money, they argue, can be better spent on patient care. In addition to these immediate savings, the government also plans to invest heavily in technology. Artificial intelligence and digitalization are key parts of their plan. They believe that technology can help the NHS become more efficient and provide better care. This focus on technology is not without its critics. Some worry that it could lead to job losses and a less personal approach to healthcare. Others argue that technology is essential for the NHS to keep up with the demands of the 21st century. The integration of NHS England into the Department of Health and Social Care has led to a shake-up at the top. Several high-profile figures have announced their departure. The Chief Financial Officer, the Chief Operating Officer, and the National Medical Director are all stepping down. These departures are significant as these individuals played key roles in shaping the NHS. New leadership will be appointed to oversee the transition and navigate the challenges ahead. This changing of the guard has added to the uncertainty surrounding the future of the NHS. It remains to be seen how the new leadership will manage the transition and what their vision for the future of healthcare in England will be. The end of NHS England has undoubtedly caused anxiety. Patients worry about potential disruptions to their care. Will they still be able to see their GP easily? Will waiting times for appointments and treatments increase? Staff are also concerned. The government has announced plans to reduce headcount by 50%. This has led to fears of widespread job losses and a potential brain drain from the NHS. While the government insists that patient care will not be compromised, many remain unconvinced. The NHS is already under immense pressure, with long waiting lists and staff shortages. It remains to be seen whether the promised savings will materialise and be reinvested in frontline care. The changes to the NHS are happening against a backdrop of crisis in the pharmacy sector. Hundreds of pharmacies have closed in recent years, creating pharmacy deserts in some areas. Independent pharmacies are struggling to survive due to funding cuts and staff shortages. This means longer journeys for patients to collect prescriptions and less time for pharmacists to offer advice and support. The integration of NHS England into the Department of Health and Social Care could exacerbate these problems. With the focus on saving money and streamlining services, there are concerns that pharmacies could face further cuts. This would be devastating for communities that rely on their local pharmacy for essential healthcare services.